So Ascension partnered back in early of 2020 to really bring a different type of healthcare to the greater Milwaukee area. And so right now we're sitting in what we call one of our micro hospitals or neighborhood hospitals. And so it's a full service hospital, really in a smaller format and a smaller footprint to be able to service the needs of patients in the greater Milwaukee area. So the term Ascension really goes back to many, many years of history of providing healthcare in this region. Now what they've done is they've went ahead and they've partnered with an organization to bring a different spin to healthcare, to the areas of healthcare where they didn't have bed capacity. And so having these small neighborhood hospitals allows us to take just as good of care of patients and getting them the services that they need in the greater Milwaukee area when we don't have those services here. So we are a full format hospital, and so we have a board emergency certified emergency department. And so really anything that you would go to a traditional hospital and emergency room for, we take care of here. We have board certified physicians here on staff ready to serve anything that walks in. We do partner very closely with EMS, so our emergency medical transport services in the area know, that if someone's having an active heart attack or an active stroke, they're not going to necessarily stop here for the patient because we'd have to just put them in an ambulance and send them to a larger center. However, everything else, major medical, anything coming in, traumas, we're able to stabilize them and work with other centers around the area to take care of patients. On our inpatient side, we're a full service hospital, so we take care of patients just like other traditional hospitals would take care of patients, just in a smaller format, smaller footprint. So general medical patients, medical surgical patients, patients that need a day or two or three of fluids, IV antibiotics, all the way up to needing experienced respiratory treatments. So full service hospital, just in a very small format. In Menomonee Falls, we're located right off of the 41 North, so 41 North and Main Street. A lot of folks refer to us as kind of the old Ernie Van Schledarns area, but we are directly across the street from the Ford dealer. Our website is ascensionwisconsinhospital.org. If you go out there, not only can you take a look at our service line, but you can also schedule an appointment. So a lot of times pre-checking in for an emergency visit, it helps really lessen the length of time that you're in an emergency room, so you're able to do that there as well. The facility itself here in Menomonee Falls was built in 2020, so in the middle of COVID. We went ahead and we opened August 21st of 2021. And really, the facility is a full format hospital, but it really is built with a lot of new age technology that really allows us to serve the needs of the patients better. So anytime you come into our organization, what you'll note, where you typically see a very large wait time in the emergency rooms, anywhere from 2 to 3 hours across the healthcare spectrum, what you'll note here is you see a board certified emergency room physician within 4 to 5 minutes. And the reason we can do that is not because we're providing any different level of care. It really is because our technology and advancements in technology allow us to treat our patients in a more efficient manner. And so again, anything you'd see at a traditional hospital, from lab to radiology to all the general equipment, that's all pretty standard in our hospital as well. Yeah, I would say one of the things that makes us unique really in this healthcare sector is, healthcare is known for individuals that go into it for really wanting to take good care of patients. And in our small format hospitals, I think the one thing that really brings the most value to us is our team. Our team is not only are they specially trained for this setting because they have to have advanced skills, they all have to take an annual assessment to ensure that they are in their top quartile of their assessment period. They also have to be well trained in ability to be critical thinkers. So we don't necessarily work with new grads. We work with all seasoned healthcare professionals that come from very, very different sectors of healthcare to bring that team concept. Our team is very unique. They really do passionately care about their patients. Working in a small format like this, it's not just about being the nurse. You're the nurse. You might be somebody mixing medications in the pharmacy. You could be the cook. You're the housekeeper. And so just having that holistic approach to providing care to the patient really is a unique way of delivering care.
I would definitely say one of the positives of working at this small model hospital is that coming from a large organization, you cared for multiple patients, you're short-staffed frequently, and you weren't able to spend that one-on-one time with the patients. You were just kind of getting in and getting out and doing your job and not really taking that time to get to know the patients. So coming here, working with a smaller team in a smaller organization, you're able to spend that one-on-one time with the patients, and you're able to really get to know them outside of being just the patient. So working here, this is probably the first time I've ever really took the time to get to know the people I work with. I used to float at my previous job, and I was always at a different floor or different hospital. So I'm able to form the relationships here with my coworkers and really get to know them both personally and professionally. We're such a small group of people. I mean, we have 7 staff members in the building at a time, and you really get to know each other because you rely on each other, you work as a team, and there's where those relationships form. So the people of Menomonee Falls have been very receptive to our telehealth model. They're very impressed seeing the doctor on the TV screen and just seeing everything that we can do with our resources that we have here.
When we really started to look at where's the greatest need and where can Ascension bring value, and it really was in the Menomonee Falls community. You know, one of the things is we all know that, you know, within 7 miles of this location, you could probably throw a stone at 5 or 6 other hospitals. But what you can't throw a stone at is you can't throw a stone at the unique care and quality of care that we provide here at this campus. And so I would say that the reason we chose Menomonee Falls is we knew that the greater Menomonee Falls area was really in need of something different and something special, something to really tailor the needs of what the community wanted. You know, in healthcare, we really get stuck on what we want as healthcare clinicians or practitioners for the patients, but really when it gets back to the brass tacks of healthcare, I think it goes back to making healthcare simple, making it accessible to patients, having patients and their families involved in their care, not having to drive 35 miles to a downtown hospital when your loved one is in the hospital, not having those unique parking challenges, particularly being an aging community. A senior individual not having to walk 1.5 miles from a parking spot. It's all those reasons why we felt that Menomonee Falls needed something different, and that really truly was why we developed this health system here. Our goal as a mission-driven organization is always to get back to the community, and so not only are we here just to meet healthcare needs, but we're also here to meet the community needs. What does the community need from us in a different way to be able to serve the greater good of Menomonee Falls?